suggest is the most effective treatment for eating problems in ASD. This is an area of interest for me. Being a speech pathologist, I am asked this question regularly, so I really want to be able to answer with an evidence base behind me. I decided to focus on eating problems. As I just mentioned, I'm a speech pathologist and I work in early intervention, and this issue, along with sleep disturbances, is brought up most often by families. When I started to research the area, the reason why it gets brought up so often became really clear to me. Some estimates put eating problems at up to 90% of children with an ASD. And eating problems are considered to be a significant stressor for families. We can consider eating issues to be like a spectrum, ranging from mild concerns with little to no impact on health and very little risk of malnutrition, all the way to eating behaviours that have a significant impact on health and pose a high risk of malnutrition. When we combine parental stress and the higher risk of medical issues, the need for evidence-based treatments for eating problems becomes clear. So far, researchers have focused on using medical, nutritional, oral motor, behavioural and other psychological methods in the treatment of eating problems. Initially, I looked at eating issues in ASD. I found quite a lot of papers. To narrow the topic, I thought about what I was really interested in for this topic and realised it was the treatment for eating issues in ASD. So I added treatment or therapy or practice to my search. It narrowed down the results quite a lot. And when I checked the results more closely, I realised there are a lot of discussion papers and very little actual research being done in the area. So then I had to expand my search again, and I ended up including papers looking at the treatment of feeding disorders for all children, not just children with ASD. I initially searched the general library site, then I searched specific catalogues. I also searched the references of papers I had that were relevant. All up, I found 14 papers to review for this assignment. While reviewing the 14 papers, there were certain conclusions that could be drawn from most of them. Most articles, while stating that a thorough assessment was important, were not clear on the assessment procedure they actually used, making it obvious that a standardised objective assessment was needed. Most studies reported that behavioural approaches based on ABA principles work best. However, it's felt that this may be a bit of a self-reinforcing cycle. That is, behavioural methods have been found to be most effective, and therefore more people use these methods in studies and report on them, and then those results get replicated. All in all, the study designs were quite limited. There were very few randomised control studies, but Lukens and Silverman admit that studying feeding disorders can be extremely difficult due to the heterogeneity of this population. Most studies mention that behavioural behavioural methods based on ABA principles work best. One study reported positive reinforcement alone can improve feeding outcomes for children with ASD. However, this result could not be replicated, and other studies found that escape extinction using the method of non-removal of the spoon was needed in addition to create positive outcomes. Many studies also highlighted the need for individualised treatment plans. Some of the studies compared behavioural methods with the addition of medication. Generally, results were better for behavioural with the addition of medication. However, it's felt that the medication addressed things like pain and gastroesophageal reflux. Success in the studies was determined by caloric intake, reduction or elimination in tube feedings, or improvements in mealtime behaviours. Following a review of the research, the following treatment plan is recommended. Before implementing any plan, it's important that we rule out any medical factors that might be contributing to the eating problem. For example, gastroesophageal reflux or pain need to be remedied. Once any contributing factors have been identified and remediated, the next step is to complete a thorough assessment. The research is unclear as to exactly what this assessment should entail, but it's suggested by Lewis Sally that the assessment needs to look at both the function of the behaviour and the cause of it. He suggests one possible theory for the function of the behaviour being that often eating problems have an escape or avoidance function. He also suggests that a conditioned food aversion could be a possible cause of an eating problem. That is, that oral ingestion has continually been paired with discomfort or pain due to medical issues, and so this association leads to the child avoiding eating. To date, antecedent manipulation has focused on fading and shaping, that is, slightly modifying food from what the child currently accepts to what you would like them to accept. Most studies used access to preferred toys, verbal praise, or a combination of the two as positive reinforcement following desired eating behaviour. As with any behaviour plan, it's important to keep data and to modify the plan as necessary. An obvious gap in the literature was the lack of randomised control studies. It was also obvious that most of the treatments occurred in the clinic setting, either as day patient, outpatient, or inpatient treatment. As children with ASD can have challenges generalising, one wonders if they would be able to generalise these new skills to other more natural settings. Another gap was the lack of standardised assessment. Many studies reported how important a thorough assessment was. However, most studies used their own assessment procedure and did not outline it in enough detail for it to be replicated. Most studies looked at a single treatment method or setting. A study comparing more than one method or setting would make it easier to compare and to establish the essential components of a treatment plan. Many parents have highlighted that eating problems can be a major stress for them, so an evidence-based guide to treatment is warranted. An evidence-based treatment should be based on the principles of ABA. A number of studies showed that positive reinforcement combined with escape extinction was effective. There were many discussion papers on this topic with very little actual research being done. This suggests a lot of conjecture is being reported. And although it's considered an area for future research, many studies reported that a multidisciplinary team is required for a thorough treatment plan. Here are just a couple of references I used in this assignment. If anyone wants all of them, I'd be happy to share them. Thanks for listening, and I hope you learned a few things about eating problems and how to treat them.